guys, welcome to this channel. We are in a different setting today because this one's a modification of my LifeToday podcast, wherein in this platform I get to converse with my family, some of my friends, and even my mentors. And in this episode, this one's a very special episode, and I am truly honored to be joined today by one of the best, just hands down professors that we have in the College of Medicine in my medical school at Salle Medical Health and Sciences Institute. He is a biochemistry professor, a physician, and of course, a mental health advocate. So without further ado, to give us advices on how to look after and even more so protect our mental health during this pandemic, we have here Dr. Jan Monzon. So Doc, siguro before anything else, you might want to introduce yourself, like a little background of what you do.
Right now, I'm full-time faculty member in College of Medicine of the Salle Medical and Health Sciences Institute. I belong to the Department of Biochemistry, and so that's my full-time occupation. And then on my clinical practice, which is part-time, I am a house physician in Nephrocare Dialysis Center. It's part of the Fresenius medical company. That's my clinic is situated in Alabang Town Center in Muntinlupa.
With what you said, Doc, you have a lot of things going on in your life today, diba? You have a very busy schedule, you're balancing time, facilitating reviews to us, and then also working, diba, on the side. So my first question to you, Doc, is how do you manage your day? Like, how do you go through a day? Like, for example, you get up in the morning already kind of like expecting what's ahead of you, like the stress of patients, influx of patients coming in, and then while also eventually you stumble upon news headlines about what's happening in our society today that are very overwhelming. So how do you manage through your day, like balancing being able to manage your patients well while also attending your needs and protecting your mental being?
So actually, I have two kinds of days. So yeah, the day that I am working from home, so it's related to my academe post, and for the times that I'm in the clinic, so I get up early in the morning, so I get to catch a ride, and kasi mahirap din, transportation is still very difficult right now, so I go with my fellow nurses. Most of the time, we anticipate the patients. We know it's going to be a busy day. And when we come across a new issue, like related to DOH, the government, and all this, especially now, no, the surging in the rise in cases.
Yes.
I think the best way for me to manage the stress that comes with that is to open up. So especially in my with my fellow healthcare workers, because we're also all going through the same fear. Right now, we feel really very vulnerable, even more vulnerable than we were back in ECQ when we back in March, back in April, because right now we see really big crowds outside. So every day is a scary experience, and the best way is really to relate, to open up to people who can relate to the same experience. I think that helps lighten up the stress rather than just keeping to yourself the frustration, the fear.
So with that, Doc, what do you think is the mental state of all the frontliners right now, and how are they dealing with this situation? Because every day there's a cropping up cases from the virus, and of course there's increasing demands from people, from communities. So how are they dealing kaya with their mental health right now?
I cannot speak for those who are really in the COVID wards, in the hospitals. They're probably really tired, and they're probably more burned out than the other, like me, who is not really working directly with COVID patients. But I think what's common among all frontliners right now is the frustration. We're really frustrated because of the ills that we see in the healthcare system, and we are all aware that the healthcare workers aren't really getting properly compensated, and there is no hazard pay for everyone, especially when the Metro Manila has already shifted to GCQ. They removed hazard pay. So parang we feel that we are all like pawns or dispensable soldiers or warriors in this fight against the virus. But we have to balance that with our commitment, our passion to heal and serve the people, our patients. Most of us, like in our clinic, we already have a really special bond with our patients. So getting up every day to go to duty to see our patients also gives us a promise of fulfillment. Although yun nga, we have to balance that out it's like a cloud of frustration that we are going to war and we don't know that any day we can become infected with the virus. So it's really a struggle. But I think the way we are getting through all this is with that sense of fulfillment that we are able to help our patients.
And with all the difficulties you've mentioned, Doc, diba, there's a lot of insufficient things that the government, you know, are not imposing to the healthcare system right now. I just have to say that I'm grateful for all the health workers that we have here in this country. Because even though you have a license, you still have the choice if you want to like go on duty. Because it's about you risking your own life. Pero for people like you and other healthcare workers who are really committed to their oath and committed to what they're doing, you guys are our heroes. So thank you so much, Doc, for helping the country. For us students, my generation, students in general, how do you think should we adapt to this new normal? Or what is a return to school like during this pandemic?
The big problem or the big anxiety for students in general is really after we got used to going to classrooms, meeting our teachers, our professors face to face. Suddenly now we are going to be in a room and then we have to go online or for everything. I think that's the really big adjustment, and that is for many. I think the first thing that comes into our mind is our resistance to change. I mean that I think that's part of human nature, and it's really hard for anyone to suddenly, without warning, without anticipation, we are forced to change our routine, to change our approach to how we are learning. But I also think that is also the main it's like the pivotal step that we have to overcome as students uh, to adjust to this new normal. I know it's difficult. It's easy to say, but it's difficult to pull this through. But maybe we, as students, we can all accept this as a challenge for us. No, someday we will be proud to say that we are the generation or we are the batch of students who went through this pandemic and who were able to pull it through.
Yes.
That really make that big adjustment, but kinaya namin and we're here. Whatever profession we end up being with.
So Doc, how about naman for us medical students?
Yeah, for expected changes as medical students, well, I cannot speak for other schools or other medical institutions, but in general, the experience of learning becomes divided into two forms, no? Asynchronous and synchronous phases. So when we say asynchronous, this is what you experienced before. Us faculty will be giving you handouts. We will be giving probably some videos or links to internet or articles which you can review on your own. And while that is probably inconvenient to some, I mean, our first notion is how can we learn with just reading and with just viewing videos? Parang where's the interaction? One thing that is good with asynchronous learning is you can do it at your own pace. And to compare it with real time or live face-to-face lectures, wherein a student goes to the auditorium or to the lecture hall, he or she can only go through that lecture once. And if he or she falls asleep, or if he or she has to go to the bathroom or has to take a call, he or she already misses a significant part of it. And there's no turning back. Okay? So having those asynchronous materials allows you, future medical doctors, to at least learn at your own pace, and you have all the opportunity to review whatever you feel that is lacking. And then there is still these synchronous sessions that our medical school will have. So these are the sessions that will engage everyone all at the same time. So it's real time. Okay? Probably through a platform similar to this, no? Like Zoom, Google Meet, or MS Teams. So everyone will be there, and that is the perfect opportunity for there to still be a semblance of the live interaction with us educators. Okay, and there is also something in between. There should be a platform where students can be comfortable in asking their professors or communicating their concerns, like having follow-up questions, clarifying, not necessarily as real time, but there should be that interface wherein students have to still feel that they are not left alone.